And now Work Matters with Julie Mann.
Hello, everyone, and welcome to that show that ponders a big question. Does work matter? And if it does, why? On this show, we explore topics that are important to creating that workspace that matters. And we do know that work matters. We all spend a lot of time there. And having that workspace matter makes a big difference on, just kind of what your day goes like. So today on the show, I'm really fired up to have with us Eric Hanna. And Eric has been on the show before, but he's an employee benefits advisor at Olivier-VanDyk Insurance. And his background is really super wide and diverse. So he always gets me thinking about things you wouldn't always think about when you think about that kind of space of benefits. But really, we're kind of going to explore today like healthcare cost control, because we all know whether you're an employee or an employer, the cost of healthcare is something that you have to think about, you have to control, and if you don't, you could be spending money one place or the other that you don't need to. So anyway, Eric, welcome to the show.
Hey, Julie, thanks for having me. It's great to be back.
Oh, it's great to have you here. So give us a quick overview, because, again, your background is really diverse, and it gives you a really neat lens into our topic. So give us a quick little background on kind of what the world of work has done with your career.
Yeah, thanks. I do help employers navigate this complex, employee benefits healthcare space. And where my passion really lies is that I want to inspire others to look at healthcare differently. You mentioned my background is diverse. I've worked in healthcare administration on the provider sort of hospital side, so I understand, how the system pays out. I've been a decision maker on benefits, and then now in the consultant broker side, it gives me a different look at it. And I think those companies that are really moving the needle are looking at their benefits differently, especially in light of the last 9 months in the pandemic, and thinking about how do we help deliver healthcare and keep our people healthy versus providing a product or just an insurance plan that the employee needs to adapt to. So it definitely is a different way to look at it, and I'm seeing some employers starting to embrace that, and it's making a world of difference on what they're paying and the type of benefit that they're delivering to their employees.
So I'm gonna take a side step on a question for just a minute. So bear with me. Mm-hmm. So you mentioned, we talk about the employee, we talk about people-centric, people first. So if I'm an employee, what can I do from an employee perspective to kind of, I'm going to say influence maybe what my employer's thinking about benefits? So if you think about, and so here's what came to my mind, Eric, when you were talking, is like, I'm an employee and I'm listening. I work for company X, right? And every year my employer comes to me and says, hey, we're going to offer these benefits to you this year. And you go, okay, great. And here's how much they're cost, and go, okay, great. If I'm an employee, other than getting that once a year kind of message to myself, are there things that I can do to kind of help my employer, since we're talking more about the employer side, that can help my employer say, here's the types of things I would like to see. Here's something I've read about. Here's a different type of benefit. What's your thoughts on that? Because I think that's kind of that people-centric part for the employer, right? Is what's the feed forward cycle for the employee into the employer. Does that make sense?
100%.
Okay.
I think it has a lot to do with the culture of the organization and how communication occurs. And so if you're saying from the employee perspective, what can I do? Talk to your employer. Talk to them. Talk to them about what your needs are, how you utilize the system. You don't have to give huge amounts of details, but what works and what doesn't work. And I would hope the flip side of that from the employer perspective is hopefully they're listening and asking those critical questions. One of the issues I find in the benefit space is we're waiting for renewal time to deal with all of this. And I think if we spread out the conversation around the whole year, right, then it starts to engage both the employer and the employee in that conversation about what fits for them first. Right. Because like I said, we've kind of found ourselves through mostly no fault of our own in this place where we're saying, here's the plan, or maybe two plans, and then employee, you adapt to it. I'm suggesting that it can go in reverse, that the employee can really be the center and the employer builds the plan around what the needs of the employee/employees are. So I think that first step on both sides is having open dialogue. This stuff is changing fast. The world of benefits is changing. Healthcare is changing. The more we go, virtual and the delivery of those services can be different. So I think the conversation and having a culture that welcomes and encourages that conversation on both fronts. So the employee feels comfortable talking and the employer is seeking to really maximize and optimize the benefit that way. Right. Everybody wins, in my view, from that conversation.
And so that kind of takes my HR mind into another pocket, because I think about, okay, so if I want to have those conversations, and we all know that medical information is, protected space and confidential space. So, bridging that gap to be able to have those conversations, in a comfortable way that works for both parties is I guess, another interesting thought to ponder.
It's another hurdle, definitely, and I don't know that conversation has to cross any uncomfortable barriers. But I think talking about utilization is one thing. Talking about conditions are something else.
That's genius. That's really good. Oh, thank you. That's really good.
Yeah. So let's talk about utilization. How are we accessing the care? Is it virtual? Is it local? Is it primary care? Where are we putting the emphasis on the delivery of healthcare? And that goes back to that people-centric side and getting out of the product.
Right.
Because maybe we can provide solutions or resources, services that are outside of the plan, but help promote and prevent more utilization. So if we can help prevent utilization up front, then obviously it's going to be less expensive downstream. If we don't have a prevention, or what I call health literacy or even health care navigation strategy, then there's going to be cost and utilization leakage downstream, where we're now paying for really expensive levels of care, like things at the hospital.
Yeah, and I think that, another part of that people-centric, and we touched on a little bit when we've chatted before, but it's that education space. How does the employer? So you could go two ways on this one. Sorry, I'm going to go back and forth on you for a minute. But, the responsibility of the employer to educate the employee on their benefits versus the responsibility that the employee has to understand their benefits. And I think both, I don't know, in my opinion, I'd love to hear yours, but in my opinion, I think that's both parties' responsibility, because I think the employer cannot simply provide the benefit without at least providing mechanisms so that employees can educate. Now, most plans have so many, online things and educational platforms that they can access, but still having some type of an education process out there to help the employees know what their benefits are. So I don't know. I think it goes on both. What do you think?
100%. It's a partnership. If we want to lower our spend on both sides, the employees' out-of-pocket cost and the employer spend, it's 100% a partnership.
Right. And
that goes back to that communication and having that dialogue happening regularly. The challenge to the hurdle to get over is that, number one, renewal time, we're sort of eating the elephant in one big bite, and that's hard for the employee.
Right.
And so it is sort of maybe the greater responsibility of the employer to make sure that information drips out throughout the year, because, the employee doesn't know when they're going to need what service a lot of times, right? Something just happens,
right.
I'm sure a lot of HR professionals have the experience where something happens after the fact. You remind the employee that benefit was available, and they're like, "Oh, I never knew that was there."
Right.
But the HR person knows that they put posters up and they did attempt to communicate that it's there. We need to try to meet them where they are from the employer perspective and continuously keep it in front and fresh. And if nothing else, that reinforces the idea that, oh yeah, when I have a healthcare issue, I go here and I can get more answers, even if I don't see that posting. But if it's part of the regular dialogue and conversation,
right,
and I know I can raise that question around, oh yeah, in the household, there's, some mental health issues. Where can I get support for that? And, well, we have an EAP or we have additional mental health support.
Right.
which, by the way, I find to be to go down a quick rabbit hole, the mental health piece is under the radar with a lot of employers. And when I have one-on-one conversations with employees around their benefits, the number one question I get is, what's the mental health benefit? And particularly younger employees.
Absolutely.
So investing in mental health is huge, but sorry, that's a bit of a tangent, but that's that same idea of being the resource and having that in front of them on a regular basis so that they know that their employer is there to support them in those needs,
right.
So that you do catch them in that moment that they need it.
Mm-hmm.
So it is a two-way street that then they have to engage and ask.
Right.
And one of my tips for employees is ask for help, find those coaches, family, HR, professionals, whoever that resource is a critical part. So partnership for sure. Well,
and you had mentioned a term, and I want to be sure for the listeners they know what they mean, but you had said an EAP. So EAP is an employee assistance program. And so a lot of employers, and the reason I want to go back to that is you'd mentioned that, on mental health, a lot of times people don't know, how to access it or what their benefit is. Well, you've also got kind of that employee assistance program. If your company has one of those, that is just a confidential service that you can call 24/7 usually, and get support on anything from, mental health to legal to financial types of support. And a lot of times, that's a good place to start just to navigate. And, I do think with the mental health, we're in pandemic fatigue. We're seeing that the mental health numbers from a claims perspective and just from a utilization is rising as everybody's just trying to adjust, everything about their world, it's your work world, your home world, and that just creates stress. And it's okay to have stress, but it's okay to say, I have benefits that help to manage that stress, which is, just so important when you have that, is to say, okay, I have access to benefits. My benefits include a mental health benefit, and I can use that. And how do I do it? So, especially in these times, I think it's so important.
100% agree. And to go back to where we started on what's that line for the employer, and knowing too much and not wanting to go down a certain rabbit hole. The EAP is a benefit on two fronts. One, it's that benefit that the employee has access to for any life issues, as you explained.
Right.
But as the employee comes to the HR person and says, hey, I'm having these problems at home or whatever the situation is, or maybe it's work performance or financial, that's a great tool to then hand back in front of them and say, oh, do you remember we have the EAP? And it helps create a little bit of arm's length in a situation that maybe becomes near that line of comfort, and so so I think it's a highly underutilized benefit that some employers have, but they're not getting it in front of their employees regularly enough for employees to know what it is or when they use it. Yeah,
I read an article recently, and I think it said that the average participation rates in the employee assistance programs, the EAP, is about 13%. That's a really, really, really low utilization rate. So
it's a great prevention piece, right? We're under investing in prevention instead. A small issue becomes a huge issue, and not only does that impact health and performance, but it impacts cost. Right.
And, it seems like this is the show of rabbit holes, so what the heck? I'm going to go down another rabbit. I'm going down another one. Go on in. So the other thing I was thinking about when we were just kind of talking about that education and reassessing your benefits and thinking about, kind of where you are is, so there's a HR term in benefits. It's called when you do the open enrollment, right? When you do that enrollment every year, employers get to choose whether they want it to be a passive or active enrollment. So active enrollment means everybody has to go in and look at their benefits and click on the buttons to sign up. Passive enrollment means you don't have to do anything. And if you do nothing, your stuff from last year will just move into the next year. And so, when we're thinking about that as, either the employee or the employer, I really think from an education standpoint of view and driving that, that people-centric spot that you talk about is, even if your employer offers you passive, be active.
Yeah.
Because life changes. I couldn't tell you what life's going to look like a year from now. And when I look back a year, it's night and day. So what do you Do you have an opinion as far as one of those two?
I agree with exactly what you said. This is a partnership, again. If we all want to control our cost by improving our utilization or how we're structuring plans, we need to be engaged on both sides. And I think employees' engagement is critical in that conversation. So I would generally discourage passive enrollment for that engagement participation spot. You said it perfect, so I completely agree with you. Now, there's components that are passively enrolled,
right? But take an active role,
take an active role, yeah, exactly.
Yeah. So, alrighty, well, hey, it is time to wrap this one up. So, Eric, thank you so much. Another great conversation, and thanks for going down all the rabbit holes with me. I appreciate it.
My pleasure.
Alrighty, and for those listening, let's be sure, let's transform today. Let's have an impact on tomorrow, and until next time, let's make work matter.